Glossopharyngeal nerve. Hi there. Welcome to video number 9 of our cranial nerve series. The glossopharyngeal nerve, or the ninth cranial nerve, is one among the top 4 nerves of the 12 cranial nerves. This is because there are only 4 nerves that have motor functions, sensory functions, as well as parasympathetic functions. The other 3 members of the fantastic 4 are the oculomotor nerve, the facial nerve, and the vagus nerve. The glossopharyngeal nerve is a communication pathway between the medulla and the pharynx. Now, this pathway has 2 types of lanes, one for input messages and another for output commands. The areas within the medulla where these lanes originate are called nuclei, and they are like the nerve's control centers. The glossopharyngeal nerve has deep connections within the medulla oblongata. Its 4 nuclei are nucleus ambiguus, inferior salivatory nucleus, spinal nucleus of the trigeminal nerve, nucleus tractus solitarius. Let us understand what each of these nuclei is responsible for. The nucleus ambiguus is in charge of giving orders to the muscles in your soft palate, pharynx, and larynx for processes like swallowing and speech. The inferior salivatory nucleus gives rise to parasympathetic preganglionic fibers that relay in the otic ganglion and then stimulate the parotid gland to secrete saliva. The spinal nucleus of the trigeminal nerve receives sensory messages from the posterior 1/3 of the tongue and palatine tonsils. Nucleus tractus solitarius is also called the gustatory nucleus and is responsible for taste perception from the posterior 1/3 of the tongue. This nucleus is formed by the fibers of 3 cranial nerves, the vagus nerve, the facial nerve, and the glossopharyngeal nerve. Pop quiz. Let's dive into the functions of the glossopharyngeal nerve. The somatic sensory fibers carry sensations from the posterior part of the tongue, the palatine tonsils, the oropharynx, and the middle ear. The visceral sensory fibers are responsible for picking up signals from the carotid body and the carotid sinus to maintain normal blood pressure and oxygen levels. Special sensory fibers carry taste sensations from the posterior 1/3 of the tongue. Parasympathetic fibers are in charge of stimulating the parotid gland through the otic ganglion. Finally, we have the motor fibers that innervate the stylopharyngeus muscle. Now let's explore the course and relations of the nerve. From the nuclei within the medulla oblongata, the nerve begins as tiny rootlets that join forces shortly after the exit to form the trunk of the glossopharyngeal nerve. It exits the cranial cavity through the jugular foramen. Here it is accompanied by the vagus and the accessory nerve. Think of it this way: cranial nerves 9, 10, and 11 exit together. Right outside the foramen, we see 2 sensory ganglia of the glossopharyngeal nerve, known as the superior and inferior ganglia. The nerve runs down the neck between the internal jugular vein and the internal carotid artery. Further down, it lies between the internal and external carotid arteries. The nerve then winds around the stylopharyngeus muscle and passes through the gap between the superior and middle constrictors of the pharynx. Pop quiz. Now let's explore the branches of the glossopharyngeal nerve. These are the tympanic nerve of Jacobson, the carotid sinus nerve, the pharyngeal nerves, nerve to stylopharyngeus muscle, tonsillar nerve, terminal branches. The tympanic nerve, or the Jacobson's nerve, arises from the inferior ganglion of the glossopharyngeal nerve. It passes through the tympanic cavity where it participates in the tympanic plexus. Its main role is to supply the parotid gland through the otic ganglion. The carotid sinus nerve is the body's built-in blood pressure regulator. When your blood pressure goes too high, these fibers help initiate a reflex that lowers it back to a safe level. The pharyngeal nerves are usually found in groups of 3. They travel medially, which means they head toward the pharynx where they participate in forming the pharyngeal plexus, with branches from the vagus nerve that supply the pharyngeal muscles and the soft palate. The nerve to the stylopharyngeus, as the name suggests, supplies the stylopharyngeus muscle. The tonsillar nerve provides sensory innervation to 2 important areas, the palatine tonsils and the oropharyngeal isthmus. The terminal branches are its lingual branches, which carry taste sensations as well as sensory information from the posterior 1/3 of the tongue. One of the ways to test the function of the glossopharyngeal nerve is by the gag reflex. When we gently stimulate the posterior part of the tongue and throat, it should cause the patient to gag. This reflexive response is an indicator of a normal nerve. If this reflex is absent on one side, it suggests damage of the nerve on the same side. If the reflex is entirely absent, it suggests that the patient may have a bilateral lesion of the glossopharyngeal nerve. In simpler terms, both glossopharyngeal nerves might be affected. Pop quiz. This brings us to the end of the session. We hope you had fun learning with us.